Is one that some of us have seen before. We did pass this out of committee last year. It's a bill that would require an abortion provider to share information with his or her patient in regards to the use of progesterone to reverse the first dose of mifepristone in 2 doses, which comes in 2 doses for a medicated abortion, should the woman choose to change her mind about the abortion. The first section includes definitions. The second section is a posting of signs in waiting rooms and consultation rooms. The third section is written consent, except in the case of a medical emergency with required record of compliance in the patient's medical record. Section 4 requires IDPH to make available materials online and assist with resources that the provider is required to post. And Section 5 allows the physician to be disciplined through the Board of Medicine for non-compliance. And those are my opening comments.
Is there discussion? Representative Wessel-Kroeschell.
Thank you, Madam Chair. A woman deserves to know the truth when she goes to her doctor. She deserves to, when she makes that appointment, she deserves to believe that she will get the truth. This bill is about lies. It is unethical, and it is about lying to women who are vulnerable. I am going to read to you from the letter that was sent to all of us who were on the subcommittee last year for the same bill, different number. And it says, on behalf of the Iowa section of the American Congress of Obstetricians and Gynecologists, we strongly urge you to oppose House File 53. We are alarmed at this attempt to interfere in the patient-clinician relationship, which requires physicians to give patients information that is not consistent with current evidence-based scientific data and medical consensus. Scripting or forcing healthcare providers to give patients unproven information runs counter to their ethical and professional obligations to their patients. Informed consent is an essential component of the provision of safe and quality medical care that allows our patients to decide on treatment based on their specific needs and circumstances. It is an ethical doctrine rooted in the concept of self-determination and the fundamental understanding that patients have the right to make their own decisions regarding their own health. By scripting physicians and compelling them to provide medically inaccurate information and steer patients toward untested procedures, House File 53 is in direct violation of a physician's oath to care. Not only does House File 53 force physicians to present patients with false information, but it goes so far as to require that they refer women to providers willing to administer the reversal procedure. This potentially subjects women to unmonitored experimentation with no assurance that they be informed that they are undergoing experimental research, or whether the experimentation has ethics committee oversight or other monitoring to ensure patient safety. Further, House File 53 requires practitioners to suggest to a patient that she does not have to be certain about her healthcare decision, creating an environment of confusion and stigma. This both compromises informed consent and undermines the trust nature of the patient-physician relationship. ACOG ranks its clinical recommendations on the strength of the evidence to ensure that women receive medically accurate and evidence-based care. The hypothesis that the effects of this drug can be counteracted or reversed has not been rigorously tested and does not meet ACOG's standard for evaluating the validity of scientific evidence. The claim is based on limited studies that are scientifically weak and rely on ethically compromised methodology. These studies are case series with no comparison groups, which is among the weakest forms of medical evidence. They also include no standardized method of treatment regimen. Further, these studies had no ethical review committee oversight, which is required to protect human research subjects. It is also unclear if proper informed consent for participating in an experimental procedure was obtained from the study's participants. This raises serious questions regarding the ethics and scientific validity of the results. Nearly 20 years of studied, properly overseen research confirms that the medication abortion regimen is incredibly safe. It is an evidence-based regimen that includes a combination of 2 drugs. Complications occur in a fraction of a percent of patients. Physicians have an ethical and professional obligation to give their patients information based on scientifically sound and rigorously evaluated research. Politicians must never script or mandate conversations between patients and their physician, let alone force physicians to give patients information that is inaccurate, unproven, or that causes confusion or distress. We urge you to reject House File 53. Thank you. If we want to practice medicine, which I do not, we should go to medical school. We have no place, absolutely no place, telling a physician what they should be doing. Absolutely, this is so unethical, I can't even believe we're discussing it at this table. Truth over lies. This bill forces physicians to lie to their patients. It's about lies. That's all this bill does, is lie. I am so disappointed in this committee. Thank you.
Is there further discussion? Representative Forrest.
Thank you, Madam Chair. I also have some deep concerns for this legislation when it pertains to the medication used to reverse this process. I looked at this and I don't feel comfortable looking at clinical trials that this is a proven way to reverse attempted abortion. So, and then the medication, progesterone, it would be most likely be administered by injection, and that drug has a lot of side effects, and it causes a lot of complications for women too. A lot of women use it to get pregnant, and sometimes if it's overdosed too much, it causes bleeding, and women can literally bleed out by using this medication if they get too much of it. So I think mandating physicians to do this is not what Iowans really want us to do. We're trying now to tell physicians how to practice medicine, and I don't think legislators should be legislating that here at the state capitol. So I will oppose this. Thank you.
Is there further discussion? Representative Masher.
Would Representative Wessel-Kroeschell yield?
I will, but I'm not a doctor.
I know that.
Thank you.
That's why I'm asking, because you're not a doctor, and neither are any of us at this table. My mic's on. Yeah, thank you. Glad you're watching out for me here. Anyway, I was just going to ask you if a doctor could be charged with medical malpractice for recommending this, knowing that it could cause damage to a woman and possibly death. Could they be charged with medical malpractice, and would they, in essence, lose their license, their medical practice and their license if they chose to do this?
I'm going to be honest with you, Representative Masher. I don't understand why a doctor would practice in the state if this was a requirement.
Okay.
I just don't understand, because certainly you bring up a very good question. Probably the legislature should be charged with medical malpractice. Oh no, I don't have a license. I'm voting no. I'm going to protect myself as much as possible. This is a horrible bill.
Thank you. I just think it's irresponsible for us to be doing something that is against their code of ethics. And doctors swear on an oath that they will protect women. And unfortunately, this particular bill certainly does not, and could make women more vulnerable. So I'm sorry that we're debating it today, and I hope it doesn't go any further. Thank you.
Is there further discussion? Okay, the chair recognizes Representative Lundgren for closing argument. Closing comments.
Thank you, Madam Chair. Here's a little truth. The abortion reversal pill, or regularly called APR, is not a dangerous, untested, unproven, or unapproved FDA drug. We're talking about progesterone. It's the hormone produced by the mother's ovaries which allows the mother's womb to carry an unborn child. The abortion drug that we talk about is a progesterone blocker. That creates an unborn baby to miscarry. According to the AAPLOG, which is the pro-life doctors organization, the first dose of the abortion pill is a reversible blocker, which means the effects can be stopped by adding large amounts of progesterone. Progesterone has been used for over 50 years in the treatment of early pregnancies of those women who are threatening to miscarry because her progesterone is too low. Progesterone has also been used for over 3 decades in women who have conceived through IVF. We have talked a lot about right to try. This is a drug that's been approved by the FDA, and it's been used for over 50 years to stop a young pregnancy from miscarrying. That's basically what we're doing here, is we're telling a doctor that they need to tell women who come in for an abortion that there is the opportunity to possibly reverse that abortion if it's taken soon enough. There are side effects for every drug. No doubt there are side effects, Representative Forbes, when we are talking about women getting progesterone for other issues. I know that as a pharmacist, you are always sharing information about drugs and what those side effects are. No drug obviously comes without risk. We also know that women have had dangerous complications from medicated abortions. And we've seen the testimonies and heard testimonies over the years here at the Capitol of women that have suffered for decades after having an abortion. Doctors also take an oath to protect life, not just women's life. And we're also talking about more than one life when we're talking pregnancy. Information is valuable. It's valuable to make sure that people know and understand what their options are. And in this case, using an FDA-approved safe drug is a way that we can make sure that women that have made a decision in haste or have changed their minds are given the opportunity to reverse the effects of that decision. And Madam Chair, that's my closing comments, and I do ask that we move the bill.
Representative Lundgren has moves House Study Bill 121. Clerk, call the roll.
Could we use our mics, please?
Representative Meyer.
Aye.
Representative Bradley.
Aye.
Representative Wessel-Kroeschell.
No.
Representative Bacon.
Aye.
Representative Bergen.
Aye.
Representative Bowden.
Aye.
Representative Brown Powers.
No.
Representative Bush.
Aye.
Representative Dolacek.
Aye.
Representative Ellert.
No.
Representative Forbes.
No.
Representative Jennering.
Aye.
Representative Lundgren.
Aye.
Representative Masher.
No.
Representative Moore.
Aye.
Representative Osmondson.
Aye.
Representative Sunday.
No.
11-6. 4 absent.
With 11